Hi, in this 5-minute video, we're still addressing flexibility and mobility in the body, and today I'm going to talk to you about hips, mobility in the hips, and mobility in the ankles, two very important mobile joints for the golf swing that are in the lower. So on a right-handed golfer, the internal rotation on both sides of your hips are very important. On the right side, you really want to be able to get a good load, so this hip is going to internally rotate. If it your knee tends to bow out, or you tend to do this, it could be because you have tightness in that internal rotation. So we're going to give you a great stretch for that side. So I'm just going to hold on to a dowel rod. I'm going to place my left foot behind my right knee, and I'm just going to keep my shoulders square and rotate around this hip. So that hip is internally rotating. You want to be careful that your knee doesn't go out too hard, and go easy on it at first, and then once you get going, you can kind of move a little bit faster, and that's going to give you more mobility and actually stability on that right side. Same thing for the left. In the downswing, your body has to turn on the left side and internally rotate. So we're going to do the same thing, rotate around the left side. Do about 15 on each side, 2 or 3 times, and remember, don't crank it too much so you don't the opposite from internal rotation is external rotation in the hip. And we don't see a lot of limitation or swing faults associated with this limitation, but there could be a few. So on the backswing, what happens is your left leg has to externally rotate. So if you take a backswing and your left knee tends to collapse a lot, it could be that you have tightness in that external rotation. Same thing on this side. If you can't bring this knee towards your left knee, it could be because you have tight external rotation, or if your knee tends to pop out this way. So an easy, great stretch for that is simply sitting down, sitting tall on a chair, and just bring your leg across. And what you want to do is you don't want to hurt your knee, so don't put too much stress, but you just want to lean forward if you can. Some of you may be up this way where there is some tightness, so just kind of ease into it and let it, and just breathe and let it relax. But you want to hold that for about 30 to 60 seconds, and I recommend doing this all throughout the day if you're sitting at a desk. And then, so you just want to feel the same thing on the other side, about 30 to 60 seconds. But you can do this as often as you feel you need to. That's a great stretch for external. I talked about internal and the external rotation. Now I'm going to talk about the limitation or tightness that you could get right here. And what we see in a lot of our clients are golfers that sit a lot, and these hip flexors become tight. And what that does is it causes the muscle causes the pelvis to be pulled forward, and it limits your hip turn or your hip mobility and stability. So I'm going to give you a great stretch here. This is a hip flexor stretch. So what you want to do is go down on one knee, and before you initiate the second move, you want to do the first move, which is contracting the glute muscle. And if you have a belt on, so the belt's going to go forward or up. You want to feel that contraction first, and then you're going to push forward. And you're going to get a big stretch in the front of your thigh or your hip flexor muscle. That's going to help you with more hip mobility in the golf swing. Hold this for about 30 to 60 seconds on each side, and do it about 2 or 3 times. So I covered the hip mobility, the 3 types: the internal, the external, and the front and back motion of the hips. Now I'm going to focus on the ankle. Ankle is probably the most overlooked joint in the body when it comes to the golf swing. So the ankle should be able to move in all directions like this. So the importance of the golf swing in a right-handed golfer is the ability to be able to roll your ankle, and on this side to be able to rotate that ankle while the foot stays stable. If not, you get a lot of moving parts in the lower body. So what we want to do first is we're going to focus on the eversion and inversion of the ankle. So basically what you need to do is just stand here, try to keep your knee as stable as possible, and turn your feet this way. And just try and keep that knee. If your knee is moving around, you probably have some tight ankles. So a great exercise, and you may not have this board available, but you can get it at any sporting goods store or on our website. Or you can just use a pillow or any type of piece of wood, and you're just going to move it around, trying to keep this knee as stable as possible and go all the way around. It's going to give you more mobility in the ankle. So you want to do that for about 30 to 60 seconds. Just just move that ankle around, and you do that on both sides. With the ankle, we want to look at the flexion and extension of the ankle. So if you tend to, in your golf swing, when you go down, your hip comes forward or your knee tends to go up, you may lack flexibility in the calf or the Achilles tendon right behind the heel area. So you want to be able to have that flexibility where you can keep the heel down. A great stretch for that would be to get down on one knee this way, and I have a stick here, and I'm just going to place the stick about 3 inches in front of my toe and keep the stick straight. Don't pull it back this way. And keeping your heel down, you're just going to try and touch that stick with your knee. So you want to keep the heel down, and you're just going to go forward. Hold it for about 5 seconds, and then come back. Try that on both sides. That's going to give you more extension and flexion in that ankle.